Hello, I'm Jerry Erickson, a genetic counselor with the Prenatal Cystic Fibrosis Screening Program at the Foundation for Blood Research. I'd like to take a few minutes to tell you about the Prenatal Cystic Fibrosis Screening Test. Cystic fibrosis, or CF, is an inherited condition. People with CF have two mutations, or non-working copies, of the CF gene. This results in the production of thick mucus that clogs the lungs and leads to infections and lung damage, making it hard to breathe. Thick mucus can also collect in the pancreas, causing problems with digestion and growth. CF does not affect intelligence. People who have CF are not always affected in the same way. Most become sick as children, and others don't get sick until later in life. Some don't get as sick as others. There is no cure for CF, but treatment is available that improves the length and quality of life for people with CF. Most babies with CF are born to couples who are not aware of CF in either family. To have CF, a baby must inherit two non-working genes, one from each parent. If only one parent has a non-working CF gene, the baby cannot have CF. If someone in your family or your partner's family has or had CF or carries a CF mutation, the chance for your baby to have CF is higher than average. If you have a family history of CF or know someone in your family or your partner's family carries a CF gene, please tell your healthcare provider. This CF screening test uses a soft swab to collect cells from the inside of your cheek. It is best if both patient and partner each send a sample at the same time. Usually we will test the patient's sample first and the partner's sample only if we find a CF mutation in the patient's sample. This will happen once in about 30 women tested. The result of the test is reported as either screen negative or screen positive. A screen negative result means that, as a couple, you do not have a 1 in 4 chance to have a baby with CF. However, there is still a very small chance that your baby will have CF, since screening for CF cannot detect all CF mutations. A screen positive result means that we found that both you and your partner have a CF mutation. This means that there is a 1 in 4 chance that your baby also has these two non-working CF genes. Other prenatal testing will be needed to tell for sure whether your baby has CF. You will have a chance to discuss the results and your testing options with your prenatal care provider. This screening test will find nearly 80% of couples who are at 1 in 4 risk for having a baby with CF. The detection rate is not as high in Native American, Hispanic, African American, or Southeast Asian couples. This is because CF is less common in these groups. I hope this information has been helpful to you in understanding prenatal screening for CF. All of us at the Prenatal Screening Program at FBR wish you a happy and healthy pregnancy and baby.